Ninth presumptive positive case of COVID-19 in Dallas County. www.nbcdfw.com News Coronavirus 9th presumptive positive C. 4 minutes ago, on Friday, Dallas County health officials announced the 9th presumptive positive case of coronavirus in the county.
It's imperative that the public do their part in following this community gathering order.
Okay, so in that same press conference, he announced 5 more cases of the coronavirus in Dallas County.
And that brings the total number of cases to 8, and that's in Dallas County alone this morning. NBC5's Vince Sims is in the newsroom following this developing news. Vince?
Yes, good morning to you. It was last night, Dallas County issuing a declaration of local disaster for public health emergency. Under this declaration, Dallas County Judge Clay Jenkins issued the order that starting today at 11 a.m., all public or private gatherings of more than 500 people are prohibited anywhere in Dallas County. Judge Jenkins went on to say that they are strongly discouraging even gatherings of 250 people. He said the people at high risk of coronavirus, which is age 60 and up, should limit their gatherings to no more than 10 people. Jenkins said during the 10 p.m. news conference that there is the possibility of people being cited if they don't comply. He says this response is necessary because there are, as you said, 5 new cases of coronavirus in Dallas County, and 1 case is from someone who did not travel outside of the area, which means they caught it here.
Yes, community spread, and we have community spread, and now it is incumbent on all of us to do everything that we can to keep that from accelerating. If that gets into our nursing homes, our senior centers, and gets to our older than 60 population, it will be deadly.
City of Dallas Mayor Eric Johnson also signed a proclamation declaring a state of emergency. Johnson says this was a necessary step that gives the city the authority to do what is needed to protect public health, safety, and welfare. The city is planning its own news conference later this morning.
Listen, I am proud to be joined today by Dr. Hellerstedt, the Commissioner of DSHS, as well as Chief Nim Kidd of the Texas Division of Emergency Management, as well as this incredible team behind me, all of whom have been actively involved in the Texas response to COVID-19, dating back at least to January, some even before that. From the very start, the state of Texas anticipated the possibility of community spread of COVID-19. Under the leadership of Commissioner Hellerstedt and Chief Kidd, working with other state and local leaders, the state has proactively prepared strategies to respond to the various scenarios that we face. In doing so, we are building on the state's pre-existing infectious disease capabilities that enhance our response. DSHS is the lead agency in the state's response. They work closely with the Texas Division of Emergency Management to coordinate the state response to COVID-19. DSHS and TDEM also work with other state agencies, local health departments, as well as healthcare providers across the state. On January the 24th, DSHS began leading daily calls with public health authorities, healthcare providers, city and county officials, as well as school districts. On January the 31st, DSHS activated the State Medical Operations Center. Last week, DSHS announced that 10 public health labs in Texas are now equipped to perform COVID-19 testing throughout the state. DSHS has established a website for COVID-19 to share up-to-date information. It'd be helpful if you get that out. It is dshs.texas.gov/coronavirus/. Again, it is dshs.texas.gov/coronavirus/. Now the state has also asked health insurers and HMOs operating in Texas to waive costs associated with the testing and telemedicine visits concerning coronavirus. We have a long list of health insurers that have agreed to comply with that request. Very importantly, for the uninsured, if an uninsured person needs testing for coronavirus, there are two options. One is public health testing or private laboratory testing. For public health testing, it requires consultation with local health departments. If the person meets public health criteria, then the person is eligible for testing through public health testing with no cost to the person. Private testing can also occur, but there could be a cost to the individual. If people need to find a local provider, they can call 211, which can direct them to low or no-cost providers in their area. As far as Texas schools are concerned, the TEA and Commissioner Mike Morath, they work daily with school districts to prepare the appropriate response for any particular school district. Commissioner Morath has begun leading daily calls with superintendents. Very important to note, Texas is seeking waivers for federal regulations for the school lunch program to give districts flexibility to provide students food should the district need to shut down for a temporary period to respond to the coronavirus. Now, some information about numbers where we are today. And understand they constantly change. But at this time, not counting the people who've been repatriated into Lackland Air Force Base, Texas has 39 confirmed cases in Collin, Dallas, Tarrant, Fort Bend, Gregg, Harris, Montgomery, Smith, Bell, and Travis counties. 220 Texans have been tested in either Texas Public Health Labs or by the CDC. And we currently have approximately 75 Texans who are being tested as we speak. Texas, some important facts I want you to make sure you get. Texas Public Health Labs have the capacity to test 273 people per day currently, with that ability to increase also with private labs coming online. Importantly, next week, CPL will be able to test several thousand per week. In addition, there is LabCorp and Quest Diagnostics that provide testing. I'm also pleased to announce something that's happening as we speak right now. It's the first drive-through testing facility. I'm pleased to announce that Mayor Nirenberg in the city of San Antonio and his team are opening the first drive-through testing facility in Texas. This has been a swift advancement with the combined effort of the city of San Antonio City Manager Eric Walsh, Metropolitan Health District Director Dr. Don Emmerich, Fire Department Chief Charles Hood, Southwest Texas Regional Advisory Council Executive Director Eric Epley, UT Health San Antonio President Bill Heinrich, and University Hospital CEO George Hernandez. This facility is opening at this moment. It will initially be for first responders, healthcare workers, operators of critical infrastructure and key resources, and certain high-risk patients. Since they've only been open quite literally a few minutes, it's too soon to tell how many people they will be able to test each day. My team is also working with the cities of San Antonio and Dallas, and is in conversation with the city of Austin to also implement drive-through testing sites that will also be run and managed at the local level. I expect and anticipate that at least two, if not all three of those cities, will be up and running next week or the week after that. Our local prepare and respond to COVID-19. I am, at this moment, declaring a state disaster for all counties in the state of Texas. Now, pursuant to this state disaster declaration, there will be many directives issued by this office over the coming days. Here are a few. This will authorize the use of all available and necessary state government resources to help prepare and respond to COVID-19. This will give the Texas Division of Emergency Management the ability to reassign and fully utilize personnel where they are needed the most. This will provide the immediate ability to move resources around the state, including resources obtained through the Strategic National Stockpile. This will empower the Texas Attorney General to pursue cases of price gouging and ensure that offenders are prosecuted to the fullest extent of the law. And my office can approve the waiving of state laws that hinder state agencies' ability to respond to COVID-19.
Social distancing measures. As a result, I'm asking that we be thoughtful and considerate in our interactions with others, especially with citizens who are immune compromised or at a high risk. We support Denton County educational institutions who have extended their spring breaks to reduce the potential for person-to-person transmission of COVID-19. We are taking steps to minimize the potential for outbreak and limit the future burden on our medical professionals and our local hospitals. Testing remains available across the county, and we are continuing to ask local physicians to test their patients who are symptomatic. We recommend, for testing purposes, go to your primary care physician or urgent care center. If individuals are severely ill, we also recommend those people seek care at the local emergency room. Again, we emphasize that hospital visits should be reserved for people who are urgently ill. Denton County Public Health has been monitoring individuals for several weeks and has coordinated many tests to public health laboratories, all of which have been negative so far. However, we know that local cases are present in the Metroplex. The measures we are enacting today are to reduce the community spread. At this time, we need to ask ourselves how we can be supportive of our fellow Denton County residents while being strategic in how we respond to this evolving health emergency. It is times like this when our nonprofits need us the most. We should all look for ways in which we can help our nonprofits and our fellow citizens. We have a skilled and experienced professional team employed here at Denton County, as well as 800 plus trained Medical Reserve Corps individuals with health care experience and background. Denton County is prepared and mobilized. We'll be happy to take any questions.
Also announce this new approach to testing, which will start in the screening website up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent.
Thank you very much, Mr. President. This is an example of another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government